There is a lot of talk now about connections between cervical cancer and HPV. More than 9 of every 10 cases of cervical cancer are caused by HPV. Almost all cervical cancer can be prevented by HPV vaccinations. And here with us today is Dr. Farley and Dr. Soni of Dignity Health Institute of St. Joe's Hospital and Medical Center to tell us more. Good morning, doctors. How are you?
Good morning.
So
Very well,
this
thank
is
you.
a very important topic because, you know, we do know about breast cancer, Dr. Farley, but let's talk about the other cancers that women's organs are at risk.
Well, again, we worry about uterine cancer, which is cancer of the lining of the uterus. Among the gynecologic cancers, it's increasing at the most rapid rate in the United States. We also have ovarian cancer, cancer of the ovaries, which is the most lethal cancer. And then finally, cervical cancer is also very prominent in the United States.
Yeah. Dr. Farley, let's talk about symptoms, because this is very important where we know that women, moms, kind of like put their health on hold for their families or themselves, and they need to really see what these symptoms are instead of just saying, oh, I'm okay, I'm going to go just take some aspirin and get back to working with the kids. What are some of the symptoms we need to look for?
Absolutely, it's very important. And I would say any bleeding, any bloody vaginal discharge that a woman has after she goes through menopause should be important. Any abnormal menstrual cycles, bleeding after intercourse, pain with intercourse, unexplained pelvic pain, severe fatigue, unexplained weight loss. These are all things that should key women patients in that something might be going wrong and they should seek care with their healthcare provider.
Yeah, very important. Okay, let's talk about how we can reduce the risk of gynocancer.
Absolutely. Again, the main cancer we have an influence in is cervical cancer, as we stated earlier. And the number one thing that can be done is for parents to get their kids vaccinated. The HPV vaccine is out there. It's very effective, and it should be given to both men and women who are at risk, because HPV-associated cancers are one of the most increasing types of cancer that we're encountering in the United States. And then finally, keep up with your screening, keep up with your pap smears. We're transitioning to screening with pap smears and looking at the human papillomavirus, which is much more accurate than actually just looking at the cells in a slide. And this can catch cancers earlier, before they become spread, and allow us to treat more patients.
Yeah, wow. Definitely important. Dr. Soni, he just mentioned about the HPV screening. Let's talk about how important that is, because that is something that women should be aware of and to do, right?
Absolutely. So, as you mentioned, almost all cervical cancers are caused by HPV, or the human papillomavirus. And HPV doesn't have symptoms, but over many years, it can start to cause changes in the cervix and ultimately cervical cancer. And we have tests that can check whether you have HPV or find those changes in the cervix or even a cervical cancer while it's still small and highly curable.
So let's talk about that. Let's talk about the care and the treatment, because that's something that a lot of people are wondering about. How does that work?
Absolutely. So there's definitely multiple different ways or different treatments that we use to treat cervical cancer. So for cervical cancers that are a little bit larger or have potentially spread to the tissues around the cervix, radiation therapy plays an important role in the treatment, combined with chemotherapy. And
doctor?
From a surgical standpoint, there are a variety of treatments. For small cervical cancers, we're able to just remove a piece of the cervix and keep that intact. For a little bit larger ones, we have the options of removing the uterus, a hysterectomy, or in some cases, just removing the whole cervix and keeping the uterus in younger patients who desire childbearing.
Yeah. Let's talk about, of course, what the hospital does to make sure that women are more secured, more understanding there, and that's where you have the doctors to talk with, and you have amazing doctors there, right, Dr. Soni?
Absolutely. So at the Dignity Health Cancer Institute, we have a comprehensive team of medical oncologists, radiation oncologists, surgeons, but also genetic counselors, dietitians, physical therapists, providers who can help with symptom management, which I think is a really important part of their treatment. And we have a sexual health and healing program that can help women who have gone through treatments for gynecologic cancers to deal with some of the symptoms they have from that.
Yeah. Dr. Farley, let's talk about after, of course, going through the surgery, doing the, of course, treatment. The team afterwards is there. It doesn't just stop with that. You guys are there with them to the end, aren't you?
Correct, absolutely. We have continued support for our patients. Again, patients are often frustrated just with the healthcare system, monitoring it, working their way through it. At the Dignity Health Cancer Institute, we're located centrally in one building. It's kind of one-stop shopping. You can come in for your appointments, get your tests, your x-rays, all in the same place and have results back, and not have to worry about calling at home, or even if you're not that computer savvy, looking on a dashboard at home trying to find your results.
Yeah, and it's just amazing. Everyone who is under that, we could say, roof of the Dignity Health Cancer Center is all connected. So if you start going through different problems, everyone is there for you, which is great. So we thank you for joining us this morning, both of you, Dr. Farley and Dr. Soni. So, and again, if you want more information about Dignity Health at St. Joe Hospital Medical Center, you can go to their website, which is on the screen. Also have information on aztv.com. So, all right, come on back. We got more Mix right after this.